I'd like to welcome everyone to our beginning of our second series on CVI. This will be our first of that series, multiple methods of assessment for students with CVI, including those who are deafblind. I would like to thank our two presenters for coming and presenting again with us, Amanda Lewick and Elizabeth Hartman. Professor Lewick has been in the field of visual impairment for over 40 years, providing direct service, training, educational professionals, and conducting research and development activities related to individuals with visual impairments in the US and abroad. Her numerous publications related to visual impairment include Vision and the Brain, Understanding Cerebral Visual Impairment in Children with co-editor Gordon Dutton, MD, Functional Vision, the Practitioner's Guide to Evaluation and Intervention, Developmental Guidelines for Infants with Visual Impairments, a guidebook for early intervention, second edition, with co-authors Dr. Deborah Chen and Elizabeth Hartman, the CVI Companion Guide, and Drs. Chen and Dr. Hartman, coordinated with their earlier Developmental Guidelines Manual. Dr. Lewick is a professor emeritus at San Francisco State University. Elizabeth Hartman is an Associate Professor of Education at LaSalle University and a co-lecturer of T560 Universal Design for Learning at Harvard's Graduate School of Education. In her research, she examines teacher implementation of UDL and how UDL is enacted to teach learners with multiple disabilities. She is a teacher of students with visual impairment and deafblindness and currently co-editing a book for the American Printing House for the Blind on the early intervention of infants and toddlers with CVI. Thank you both for joining us. Please take it away.
Well, I'd like to welcome you all to this third session in the webinar series on CVI. And these next two sessions, as Jen mentioned, are going to be dealing with multiple methods of assessment for students with CVI, including those who are deafblind. And I'm going to go over the agenda for this webinar. First, we're going to talk about the purpose of assessment. We're going to talk about collaborative and holistic assessment, talk about multiple methods of assessment, and what about CVI behaviors and typical assessment tools? How are we going to integrate working with children with CVI when we're using typical assessment tools? And then how to proceed in an evaluation is going to be the bulk of the seminar. I'm going to turn it over to Dr. Elizabeth Hartman for a second to talk about how you can contribute to the conversation.
Hi, good afternoon, everyone. As has happened in previous webinars, I'm going to be working the back channel, meaning that I'm going to be talking with you in the background using the Q&A. So if you have any questions during the presentation that you'd like to ask, please feel free to engage with me using the Q&A. And I look forward to chatting with you all.
Okay, so before we begin, let's think about assessment in CVI, all of us. What do you hope to learn that will help you assess children with CVI? And please share this in the Q&A. And as we present, think about how the information presented applies to your assessment practices. Now, there have been some burning questions that I want to answer also before we go into the bulk of the webinar. First, whenever I present about CVI and do all the background material, I see size in the audience. How do I handle so much information? And all I can recommend to you is the method that I use, and that's integrating information one step at a time. Each child presents an opportunity to understand more about CVI. And that information can be of help in understanding other children. So as you learn something and you see it in one child, you'll be able to see it more and more in the other children that you're working with. And it gets a little bit easier over time. It's important, as we've talked about before, to know what to look for. And that takes time because, as we talked about in the earlier sessions, there are 16 overall categories of characteristics of children with CVI or manifestations of CVI, and these can be broken down into over 50 different manifestations of CVI, and that's probably going to change even more as more information comes to light from the research and practice communities. The next question is, do I have to do this alone? And we stress that multidisciplinary assessment is essential in most cases. And with this, it means that case management can be different for different children. It depends on all the other things that are going on with the child and who's on the assessment team. So not every case of CVI has to be managed, for example, by teachers of the visually impaired. Maybe another specialist who is the case manager. Another question that comes up is, how much time does all this take when I have so much to do? I have to stress that understanding children with CVI, as with all children who have complex conditions, does take time. The advantage in a school situation is that practitioners can work with children over time to observe, evaluate, and learn. I learned a lot one time when I was doing outreach work in a state and worked with a very fine teacher who had child with multiple disabilities on her caseload. And we were talking and she said, you know, sometimes it takes me about 2 years to really understand the children that I work with. Understanding children with CVI does take time. It can't be a one-shot deal. Next question, I really want to learn about interventions. When are you going to start talking about interventions? And I want to stress here that interventions and assessments are tied to one another, and we'll begin to talk about that in this webinar. Before any interventions can be developed, it's important to clarify the nature of a child's CVI, and then the interventions that follow can be more focused and effective. Let me give you an example. If a child has problems with visual neglect on one side, or has trouble with eye movements moving into a certain quadrant of their visual field, has visual field problems, or has problems within the brain, such as agenesis of the corpus callosum, we have to be careful about wanting the child to track because they may not be able to do that really easily. And it may be better to use sometimes some type of accommodation so that they can look into the area of their field that works best for them. And depending upon the cause of their inability to track, work from that cause rather than trying to do some blanket overall intervention that may or may not work, that can frustrate the child and take a lot of time. Another example, in ocular visual impairment, there's really no point in trying to get a child with super reduced visual acuity to be able to see something at 15 feet away if they can't see it because their vision is blurry. We have to make accommodations for that. And so we have to understand how a child's CVI manifests in order to determine which interventions and accommodations are going to be the most important, and then how to balance and rebalance these as the child progresses. So let's now go into the meat of the presentation and talk about the purpose of assessment. We all say we need to do assessment, but let's talk about why we do assessment. It can be for diagnosis, and only certain specialists can diagnose CVI. But we all can do identification of manifestations of a known condition. We can do screenings to help to identify problems early, with the evaluator actively looking for specific manifestations of a condition. Now, you can also do screenings as a prequel to diagnosing, but again, that falls in the range of certain practitioners, mostly medical, and it may be neuropsychological in terms of identifying CVI. Other ways of using assessment for specifying or verifying problems is to gather baseline data to measure change over time. We're going to add to this list functional vision, including visual processing for children with CVI. And we want to know how children progress and process within key tasks. And we're going to be stressing process within these webinars, because we don't want to just see the outcome of an assessment. We want to understand what it took the child to do to reach those outcomes, because those will help us determine the best interventions and accommodations. Making decisions about students is another purpose of assessment. We want to identify areas of strength and challenge. And another purpose is gathering data for determining interventions. As I mentioned a little bit earlier, interventions and assessment are intimately tied. We need to know whether we want to do direct skills instruction, adaptations, compensatory activities, and we want to educate about the condition for the child, the family, staff, and peers. We need to look at environmental analysis and restructuring, and guidance and counseling is needed for the child and family so they know how to work with the child, understand why the child might appear to be clumsy when they're not. It's actually a manifestation of CVI that is causing them difficulty not seeing things in their super lower visual field, or bumping into things on the left, or not being able to pick out a person from a crowd. So with assessments, we have to make some decisions, and we have to consider the goal of assessment, the assessment team, assessment priorities and methods, translating findings into interventions, intervention priorities, the intervention team and the case manager, and the method and timing of follow-up assessments. Children with CVI change, and we need to follow up what we're doing with the child to be sure that those methods don't also need to be changed. So let's talk about collaborative and holistic assessment. These are some of the specialists that can be involved in collaborative assessment of children with CVI. Ophthalmologists, optometrists, orthoptists, pediatric neurologists, neuroradiologists, regular classroom teachers, orientation and mobility specialists, occupational therapists, pediatricians, physical therapists, psychologists, neuropsychologists, speech language pathologists, caregivers, the child student himself or herself, and there could be others depending upon the nature of the child's CVI and medical condition. So we're also calling for a holistic approach for students with CVI, looking for ocular and brain-based visual impairment. Consider possible attendant disorders. Look at vision within the context of the whole child. Pinpoint areas of strength as well as challenges, because you're going to work from these areas of strength. And also recognize that assessment is multidimensional, because children are multidimensional. Multiple methods of assessment. Now, I've been talking about this for a number of years now, and I'm going to keep talking about it because I think it's really, really important. There's a research method called triangulation of data. And this can be applied to the assessment of children with CVI. So let me explain that. Multiple data sources can capture different aspects of the same phenomenon. Inconsistencies across data sources can be a source of strength. They can provide a way to explore the deeper meaning in the data. Let me give you an example. First, let me give you one from ocular visual impairment. We all know that children with ocular visual impairment may show different visual acuities in a clinical setting in an exam room with perfect lighting and perfect quietness and a perfect chart. But if you try to look at visual acuity in a busy classroom or with less perfect lighting and with the different charts, you're going to get different responses. And it could be that using a familiar evaluator can also result in different results from the child. The child may be nervous or hold back in a clinical setting, and they may just be more relaxed in a classroom. So you can get different results, but these different results give you a deeper understanding of how that child functions and how the child will operate in a real world situation rather than in a clinical setting. So neither of these results are quote unquote wrong, they're just different. And that difference is important in terms of determining interventions. Let's apply that to children with CVI. Children with CVI can function very differently in different environments. So where a child may do really well in a very quiet place, exploring a room that's empty of noise and sound and other people, when it's filled with children and lots of talk, they may flounder. They may operate very differently. These results are not wrong. They're just different. And they give you different ways of working with the child in different environments when the environment is different. So for children with a complex condition such as CVI, using multiple methods of investigation is a reasonable course of action, because at this time we don't have one system that evaluates all possible factors associated with CVI. So what about CVI behaviors and typical assessment tools? Before we go into detailed assessment methods, let's see how behaviors due to CVI might affect performance on any observational, informal, or formal assessment. We've presented the CVI profile categories before. Here's a list of them, and I'm not going to be able to go into them in this webinar. You can go back to the previous webinars where we, especially the last one, where we went into this in detail. But we can look for possible items in terms of the manifestations of CVI related to vision on infant development scales, for example. We can look at a few generalized items from these scales to see how performance of children with CVI can be affected by the way their CVI manifests. For example, on the Oregon project, and I find this a very helpful tool, they suggest writing comments associated with each item. This is especially helpful for children with CVI because we don't want to just know achieved or not achieved. We want to see how the children process each item. So here are some items from generalized assessment tools. Here's one on visual attention: a regards face or a moving object for a specified period of time. So I've listed some of the manifestations of CVI that can affect regarding a face or a moving object for a young infant. So it could be accommodation, visual acuity, visual field dysfunction or neglect, contrast sensitivity, ocular motor issues, visual search. I'm going in the ones that are in brown on this slide. Visual attention, intersensory attention, face object shape, letter recognition, speed of the moving target, salient preferred stimuli, and blind side effects. Those ones in blue are likely not affected, and the green one, a visual clutter, it depends. It depends on how the face or the moving object is presented in the environment. But you can see that regards face or a moving object for a specified period of time can be affected by many of the possible manifestations of CVI. And so the item is not as clear cut as we think. And so what can affect the child's processing of this item is what we really need to be aware of. And if you have another specialist who isn't aware of CVI, it's important to indicate this to that specialist so they know how to interpret the child's functioning on this item. Here's another one for visual attention, glances from one object to another. And many of these things are also involved in glancing from one object to another. That could be a manifestation of CVI. And I've listed those here in brown. And the ones in blue are likely not affected, and green depends. And I will tell you that as I kept going over this list, I kept changing what color I made those items because CVI is so complicated that, you know, it could be affected in some cases and not others. Glancing from one object to another, what if the child can't recognize the object? So I put that in green with face, object, shape, letter recognition, and I kept moving it in and out of that category. So there's fluidity here. It's not all or nothing. But what we have to be aware of is that these things can affect glancing from one object to another. Here's another, points to two large pictures in a book. That's visual recognition. Well, all these things can affect the child's ability to point to two large pictures in a book. And I'm going to just show you just a couple in pointing these out. If we go down the list, we see here, visual search can be affected. Visual guidance of movement can be affected. Intersensory attention between vision and pointing can be affected. Visual guidance of limbs can be affected. Global versus focal. If a child is going right to looking at a picture of a flower and goes right to the center of the flower, the dark part, they may miss that the whole picture is that of a flower. So many of these things can be affected in terms of answering an item, points to large pictures in a book. So let's go to conversation question 2. So in assessment performance, we need to analyze and gather evidence about how the child's CVI manifests, how the child experiences the world, and how to determine and set priorities for the most appropriate interventions. Now, I want to go into point 2, how the child experiences the world. Children with CVI experience the world very differently than people with typical vision who don't have brain dysfunction. We have to somehow insert ourselves into their heads and their hearts and understand how they experience the world and understand what they're facing when they have to work with their CVI in the school, at home, in communities, with their peers. Assessors of children with CVI need to understand the underlying issues that affect performance. And that's not just TBIs, that's psychologists, that's anybody who works with a child with CVI, speech language pathologists, orthoptists, because it affects the outcomes of any of the assessments that they'll be doing. Now, how to proceed in an evaluation. We've talked before that it helps to know possible behavior manifestations to be on the lookout for when a child has a condition that might lead to damage to the visual brain. So we can look for visual features of CVI from MRI reports. And in the book, Vision in the Brain, in Appendix 3A, there's a whole list of these things to be on the lookout for. And here's an example. If the MRI report shows damage to the left posterior parietal lobe, that's the lobe that's at the top of the brain. There can be intermittent lack of attention on the right side, a tendency to miss people and events on the right side, a tendency to bump into people and objects on the right side, especially when tired or upset, reduced accuracy of visual guidance of movement of the right side of the body, a tendency to be left-handed because this becomes the dominant hand, weakness of the right side of the body as a result of damage further forward in the brain, difficulty with spoken or written language because the left parietal lobe serves language. And again, this goes into the realm of speech language pathologists. And when drawing, the right side of the picture can be distorted. Now, not all these things are going to manifest in every child with damage to the left posterior parietal lobe, but this gives you an idea of what to look for. If you don't know to look for it, you might miss it. Different medical conditions may have different visual consequences. One needs to check for each condition. For example, with premature birth, we all have to look for low visual acuity with no ocular disorder, inability to find someone in a group or objects in a pile, inaccurate visual guidance of movement, and difficulty reading crowded text. There's an Appendix 3B in Vision in the Brain that lists things to look for when a child has specific conditions. Now again, children with CVI may not manifest all these things, but it's important to look for them. I want to give you a tip. When I work with children with CVI, I spend a lot of my time ruling out things, honing it down so that I say, oh, this is not manifesting in this child. This is not manifesting in this child. This is not manifesting in this child, but this may be, and I'm going to need to look for it further. And this may be, because I'm going to need to look for it further. And it makes me feel more comfortable knowing that I've taken a holistic approach, looked for all these things, and ruled most of them out. Then I think that's wonderful. Not all these things are active, and now we can start focusing on what is active for this child and how to assess them and consequently make appropriate interventions. So the CVI profile also lists many of the behaviors to be on the lookout for. And that's why we identified all those things in the CVI profile, to make things easier for people to just check off as not in action and to look for things that are active in a child so that they can go into them further. So summary, knowing what to look for. It helps to know possible behavior manifestations to be on the lookout for when a child has a condition that might lead to damage to the visual brain. We can look for visual features of CVI to consider from an MRI report. Different medical conditions may have different visual consequences. Look for other issues associated with dorsal or ventral stream disorders. If you find one issue, and we talked about that in an earlier webinar, if you find that a child manifests one of the dorsal stream behaviors, it's important to look for all of them and hopefully rule most of them out. And then you can also check the CVI profile categories. But I want to caution you, keep an open mind, as you may find things that you weren't looking for. I've had that happen. I'll read a report, I'll look at the history, I'll look at the medical condition, I'll read what people have found, I'll go see the child, and then bam, I see something totally different from what I had expected. I throw it out and I'll say, let's start from here, or I'll add that to all the things that have come before to try to make sense of how that child operates in the world, how the child experiences the world, in order to make recommendations for possible interventions. Please remember that those of you who are doing assessments need to trust what you're seeing. If you see something that's odd, go into it a little further. Get advice from other people on your team and see if it's related to CVI or something else. And talk about methods to gather evidence of the behavioral consequences of CVI. We mentioned in an earlier webinar that we're recommending multiple methods of assessment, and the way to organize them would be to look at the evaluation area, and our evaluation areas are related to the CVI profile, but there could be things that are not in the CVI profile that you want to include as an evaluation area. That's perfectly okay. Nothing in CVI is hard and fast. What is fast but not hard is all the changes in our understanding of CVI that are coming out all the time from research and practice. And we have to be flexible and flow with all of these changes. You need to look at the sample indicator behaviors that you found that might suggest some issues with the CVI. You want to look at evidence from interview and history taking, evidence from formal and informal assessment, including observation. And I want you all to trust your observational skills. A lot of what I do is based upon observation. A lot of what I trained our teacher candidates at San Francisco State and elsewhere is based on keen observation skills. And then in evidence from observation in the environment, we have to specify the environments, because I mentioned earlier that a child may operate very differently in different environments with different people, differently after lunch, differently earlier in the morning, differently later in the day when they're tired, differently when they're sick, differently when they're hungry, differently when they're anxious, differently when they're happy, and differently when they are motivated or not motivated. Let's give a hypothetical example of a young man who we will call Miguel. And Miguel was 5 weeks premature and was having difficulties in his kindergarten class. The education team was on the lookout for the following possible visual consequences of premature birth: reduced visual acuity in both eyes with mild myopia, inability to find someone in a group, possible simultanagnosia, which we've discussed in an earlier webinar, lower visual field impairment, which may be very peripheral, inaccurate visual guidance of limb movement, possible dorsal stream disorder, and difficulty reading crowded text, which is another indication of possible simultanagnosia, the inability to see more than one thing at a time. So Miguel's background, his medical evaluation, his eye doctor found that he had 20/50 visual acuity in both eyes, a mild reduced lower visual field, and mild myopia in both eyes. His pediatrician recently referred Miguel for an audiological examination for suspected hearing impairment. Now, with history taking and observation, his mother reported that he had difficulty finding her in a crowd of adults waiting for the children after school until he heard her voice. His teacher reported that he had difficulty playing in a game with other children with a large ball at recess. He couldn't easily catch and kick the ball. And Miguel seemed to be disoriented when the children had to find their class table in the crowded and noisy cafeteria, but he could find it when there were only a few children present. So more information was gathered during the functional vision, orientation and mobility, literacy and math evaluations that followed related to potential dorsal stream issues, pre-reading and reading, mobility, and sports. And school staff are now carefully observing Miguel for indications of impairments in hearing and auditory processing, pending results from his audiological exam. So, setting the stage for educational assessment of children with CVI, it's critical to be sure that necessary optical prescriptions are in place, or if not, note behaviors elicited under less than optimal conditions. Now, if a child has not had an eye exam and been tested to see whether they need glasses or not, that's not going to be helpful, because the child could have a problem with just that could be corrected optically, and that really needs to be known before any assessments are done. If the child doesn't want to wear eyeglasses, it's important to determine the reasons. Maybe the eyeglasses don't help. Maybe they're not comfortable. And if the glasses don't help, what's wrong with them? Does the child need another examination? If they're not comfortable, how can they be made comfortable? And are there ways to prepare the child to wear glasses over time, wearing them during activities that are really important for the child, where the child is motivated to see, and increasing the eyeglass wear time? It's important to be sure that optimal positioning is established, especially for children who have multiple disabilities. And we need to be certain that biobehavioral states are optimized, or if not, note behaviors elicited under less than optimal conditions. If the child is operating in less than optimal conditions, we can't expect the child to do certain things, and parents and school staff need to know this. That's very helpful information. That's triangulation of data. It may be that training the child to do certain tasks under less than optimal conditions is not what we want to do. Where to start and where to go. We've divided assessment into 3 tiers in vision in the brain. And these are not hard and fast tiers, but it helped me in understanding the types of assessments that we need to do with children with CVI, and it helped me in trying to explain this to others, and I hope that it helps you. So tier 1 is evaluation of ocular and neuro-ophthalmological concerns, screening and history taking. So it includes history taking, visual acuity, contrast sensitivity, color vision, visual fields, eye movements, screening for auditory and perceptual issues, and history taking. We can do formal clinical examinations as well as of educational functional vision assessment at this stage. This prepares for deeper analysis for the evaluation in tier 2 of higher order processing disorders, the brain-based visual concerns such as dorsal and ventral stream dysfunctions. And for this, we do interviews of caregivers and staff, observations, and formal and informal testing. But we have to take it a step further for children with CVI. We need to look at tier 3, evaluation within real world tasks in the school, the home, and the community. We need to do observations, interviews, and formal and informal assessments. But if you're looking at reading assessments for a child with CVI, we have to remember all those manifestations of CVI that may enter into the child's performance on items in a reading assessment, on items in an IQ assessment, on items in a speech language assessment, on items in a mobility assessment, in order to understand how the child processes information and what the outcomes of those assessments really mean. We don't want children to be labeled or mislabeled when the manifestation of CVI is the problem rather than cognition or developmental coordination disorder or autism or other things. Question 4, how could you prepare to conduct an assessment of your student with CVI that addresses all 3 tiers of assessment? Tier 1, the evaluation of ocular and neuro-ophthalmological concerns. Tier 2, the evaluation of higher order processing disorders. And tier 3, evaluation within real world tasks. Any questions for us, Dr. Hartman? Okay, so in the next webinar, we're going to take a deeper dive into actual assessment tools related to CVI and assessment methods related to CVI. But it was important in this webinar to put assessment into context, because you can't just say, oh, here, I've got a child with CVI and I'm going to assess them. You need to understand why you're assessing the child, how this fits in with all the other information that you have with the child, how to understand the child's process in answering assessment questions on formal and informal tests, why the child is operating in the way the child is operating. And again, as I mentioned, most importantly, understanding how the child experiences his or her world. Now, I want to thank all of you for all the work that you're doing with your children with CVI and their families. Now, this is the first rose of the season in my garden that just came out this week, and you can't smell it, but it smells so beautiful, and you can see it. And this is our gift to you, to thank you for all that you're doing. And we hope that you'll join us for the next webinar, because we'll have more specific information for you that will fit into the context of assessment that we just presented to you today. So we want to thank you very much and turn it over to Jen.